So to help us understand what's driving these decisions and what it can mean for local communities, we're joined now by Jennifer Anderson. She is the president of the New Municipal Association of Victoria, and she joins you now. Good morning, Jennifer.
Good morning, Rebecca.
So how widespread is this of councils handing it back to the state government across regional Victoria?
I think it's a conversation about a lot of things that council is doing, not just maternal child health, in that we know it's an excellent service that Victoria offers, special to Victoria, triple qualified nurses, as your caller said before, just a great support. But councils are under huge pressure at the moment in terms of finances. And this program was established to be a 50-50 partnership with local and state government. And over time, that has sort of eroded and councils have had to pay more and the state government less. So we at MAV are working with the Department of Health to try and rebalance that co-funding to make it easier for councils.
And why has that been happening? Why have that 50-50, these scales have been uneven, Jennifer?
I think it's something you'd have to ask the state government, because we certainly know at a local government level we've been saying for some time that this level of funding has been dropping off, and the costs to staff and everything else involved with the service has increased over time, yet the funding hasn't. So it's with a lot of things. I think it's just really making sure the state government does appreciate that costs are going up for councils, and councils need to look at what is the best thing for them to do, and a place-based approach for maternal child health is the best way to respond to a community's needs, but we do need the funding to do that.
Okay, so it's a money issue. Well, they say last year they provided $202 million for maternal child health and early parenting centres across Victoria. Has this been enough to keep these gold-class world standard services? Well, obviously, if this hasn't been enough, if the council are having to pay more.
Well, I'm sure councils are looking at the financial side. They will have explored other issues as well, but we can definitely tell you, and we have been talking to the state government about the money. It sounds like a lot of money, but it's certainly not covering that 50-50 cost sharing that councils have been doing in the past to provide this excellent service.
So what are councils telling you about why they're stepping away from the service delivery? What are their reasons?
Well, they'll all have their own reasons, and no council steps away from a service lightly. They have a discussion about the pros and cons, and they make their own decisions. So we're not in a position as a peak body for all 79 councils to comment on individual councils' decisions, but we can say that we know overall that 50-50 funding split no longer occurs, and if you are able to get that appropriate funding back in place, it does certainly assist with providing that excellent service that we do provide.
And do you know, for councils that have made that transition, Jennifer, whether they're completely using the people having to use the public sector or using private providers to provide this service to their ratepayers?
Yeah, I'm not completely across what each individual council has decided, but I do know that most councils, if they're looking at getting out of a service, do have a really good look at what other services are available to their community to ensure that their community still has some form of service available to them.
Yeah, a lot of people have, a mother we just heard from and the Australian Nursing Midwifery Federation said they're very concerned about this model, which, as we've said, is very highly qualified and well recognised gold class standard across the world, is going to be replicated in these new models when the councils hand back this service. Does it seem to be happening in central Victoria specifically? We are going to be catching up with the Loddon Shire very soon that have made that transition. We know the Campaspe Shire Council have done it also, and now the city of Greater Bendigo. Do you think there is a reason why it's happening specifically in this area?
I wouldn't be able to comment on that. As I said, we're the peak body for all councils, and we support any council's decision to help them do what they think is best for their community. But I couldn't comment as to why there's particularly a few in the central Victorian region and whether others are considering changing their model.
So you mentioned, Jennifer, that you're working with the state government and the sector to identify ways to make this service more sustainable. What the government saying too? They are working with councils and the sector to identify the most effective and sustainable ways to keep delivering this vital service. What do you want that to look like?
Well, at a minimum, that 50-50 partnership that used to be in place, so that, you know, the costs are increasing, and we want to make sure that we're appropriately paying these incredibly qualified staff who we know do a fantastic job in our community. You ask anyone who's been to a maternal child health nurse, it's a vital service. So we will continue to talk to the state government about how that funding model needs to be reinstated.
But in the meantime, councils are left with no choice but to hand it back to the state government. A community council's concerned that that's, as far as this model goes, and what this will mean for parents in their areas.
Well, councils always consider their community, and it is a place-based model that councils need to look at. So councils do many things that the funding has dropped off from state government funding, things like school crossing supervisors, for an example, libraries. Councils continue to fund things that the state government has slowly over time reduced the funding or kept the funding the same when costs have gone up. So we continue to have conversations with the state government about how important these services are to our communities to ensure that they are adequately funded, and councils, if they wish to, can continue to provide those services.
So this work that you're doing with the state government at the moment, coming up to a state election, you've got any deadlines on when you would like some of these negotiations or outcomes to change?
We've been working with them for quite some time. It's not just a state election campaign, it's been an ongoing conversation because this funding has dropped off sort of slowly over time. So we'll continue to work with them. We will certainly be working with the Australian Nursing Midwifery Federation. I've probably got that acronym incorrect.
No, you're right.
Maternal child health nurses. We're a collaborative organisation. We want to work with everybody to get the best solutions for our communities, but we do know that 50-50 partnership that used to be in place seem to be a good model, and we want to ensure that there's a minimum of a 50-50 coming from the state government.
Jennifer Anderson, thank you very much for your time.
My pleasure.